Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. I'm going to tell you why I use the body composition analyzer in my obesity clinic. I've stopped using a weighing scale because I find that's useless. It doesn't tell me anything except for the number on the scale. It doesn't really help me or my patients. So my patients in the UK, some of them come to me and I find that the body mass index is 45. So obviously that's classified as obesity, because anything more than 30 in a Caucasian is classified as obese. But this person is a rugby player. He came to me for a thyroid problem. He didn't come to me for obesity. Based on the BMI criteria, he should be classified as obese. Whereas when I did a body composition analysis, his fat percentage was 4%. That clearly showed that he is not obese. So obesity is diagnosed based on the fat percentage. We use body mass index because it's easy to do, it's cheaper. So everybody does body mass index, which is based on your weight divided by your height in meters and you square it. The reason we use BMI is because it's easy to use. But the fact is it doesn't help our patients, especially if they're on a weight loss journey. So I'm going to give you two examples of my patients, how the body composition analysis helped them to continue and be successful in the weight loss journey. So before that, I'll briefly tell you about body composition analysis. Here I've got one. So it's based on bioimpedance. It's a non-invasive, so there's nothing going to happen to you. It's based on the electrical currents going into your body and the resistance your body provides to that electrical current. So that's called bioimpedance. The only contraindication is I won't use it if someone has got a pacemaker, if they got a metal in the body, obviously if they have fractures, some people have metals, then they can't have this procedure. And I don't do it at menstruating. So these are the main things I avoid. Any metal, pacemaker, pregnancy, that's clearly is a no-no. So everything else I use, but I also make sure they don't have food or fluids for at least 2 hours. Preferably, I do serial body composition analysis every month or every 2 months, but it's a similar time of the day. So that helps me analyze. Okay, coming back to two of my patients. So this particular lady comes to my clinic. Now, she came to me for something else, but said, look, I'm very concerned about my health. My parents have heart disease and diabetes. Can you please help me reduce my cardiovascular risk? So we did her body composition analysis, not her weight. Her weight was 53.7 kilograms. Usually that's less. And her body mass index was 22.4, which clearly is normal even for a South Asian. As you know, for South Asians, the cutoff for obesity is 27.5. So anything more than 27.5 is obesity for South Asians, whereas for Caucasians, it's 30. So this lady is of normal weight. That's what you would think if you had just used a weighing scale. So with the body composition analysis, what we found out was her percentage of body fat was 40.1. That's very, very high. Clearly, she is obese, though her BMI is only 22.4. So she is more likely to have cardiovascular problems, development of diabetes, polycystic ovary syndrome. She could have lots of other medical conditions. So this analysis helps us to provide a good insight and this helps to help my patients to deal with their life better. And I can give them better interventions. This also tells me what should I do to help her. In addition to the fact that she had very high percentage body fat, or skeletal muscle mass, which is lean body mass, which is the part of the body which burns calories, was very less. It was only 17 kilograms out of the 53 kilograms. Our skeletal muscle mass was only 17. And then we did a regional or segmental lean body mass analysis. So what it tells you is which part of the body has got more muscle, less muscle, or normal muscle. So in her, what we found out was both the lower limbs and upper limbs both had low lean body mass. So now what I'm going to tell her is not just lose weight, because she's got nothing to lose. She's only a body mass index of 22. How do you tell her to lose weight? So over here, what I'm going to tell her is to improve her muscle mass. That's what I'm going to ask her to do. So she's sarcopenic. So I'm going to increase her muscle mass. So when she bulks up with her muscles, she's going to burn more calories and she's going to drop her fat percentage. So that's what I'm going to do for her. Can you see that? If I had just a weight, I would have told her, look, you're fine, your body mass index is fine, you're discharged. But here, there's completely a different story. So that's my first patient. And as I promised, I'm going to show you my next patient. So this gentleman, he came in for weight management. So unlike the previous one who came for improving your health, this person came specifically to reduce his weight. So he's a 47-year-old person with weight of 100.5 kilograms. And his fat percentage was 38.3 and body mass index 34.5. So obviously he's in the obese category because his body mass index is 34.4 and his fat percentage is 38.3 and skeletal muscle mass 34.7. So we did some intervention, we gave him some medications, counseled him, did exercise. Our dietitians approached him and gave him advice, and also seen by our psychologist. So he came back after a few weeks, and I'll show you what his the repeat body composition analysis was. So after a few weeks, his weight was 101.2. So if you remember, when he came in, his weight was 100.5 and now the new weight is 101.2. So he had gained weight and he was quite disillusioned. His wife was very upset. She said, look, you did everything you said, and despite that, he's just put you on weight. And they were very upset and she was saying, look, he's cut down his food. Then I showed them the details of the body composition analysis, which showed that he had in fact gained muscle. His percentage body fat had dropped from 38.3 to 36.8. So his percentage body fat had come down and he had gained muscle. So his muscle mass increased from 34.7 kilograms to 35.9. So the gain in weight, which was registered on this body composition, was due to the muscle. Can you see that? Actually, he's become more healthy. So this is what I explained to his wife and him, and then they were very reassured. They were very happy that they were going in the right direction. So as you can see, that it's very important to have a body composition analysis in your obesity clinics so that our patients can be helped. Thank you.